Dynamic Documentation Emergency Department Course Workup. In an effort to improve communication with primary care providers, the ED Depart process has been modified to include a new menu item, ED Provider Documentation. From the e-tracking list, click on the patient you are ready to discharge and begin the Depart process. The new ED Patient Depart Process menu displays. Completing these steps individually will pre-populate your ED provider documentation note with relevant patient information requiring the provider to complete the ED course section of the note. Clicking on the pencil in the EP Discharge tab places the house icon on the tracking board, signifying to all users that the patient is ready for discharge. The ED Prescription MedRec tab will allow the provider to enter discharge prescriptions for the patient. The Discharge Diagnosis tab allows a discharge diagnosis to be added to the patient's chart. The diagnosis entered will pre-populate the note and provide suggested options for patient education. Using the Diagnosis Quick Search box is the most efficient way to enter a discharge diagnosis. As a diagnosis is entered, the most commonly used diagnoses will appear. The discharge diagnosis will show in the diagnosis section of the patient's chart. To add additional diagnoses, repeat the previous step using the Quick Search box. When finished, click Close. The Patient Education tab populates suggested education based on the discharge diagnosis entered. Click on the pencil icon to search for additional patient education. To search for additional patient education, select All in the upper right corner and type the desired education in the search box located on the left. If searching for a custom St. John Providence education, verify the search type is set to Contains, and then type SJPHS in the search box. Double-click on the education to add to the patient's chart. When finished, click the Follow-up tab. Select the follow-up information by searching for provider, organization, or entering a free text follow-up. The information entered in this section will flow to the patient discharge summary. The follow-up information can be saved to your favorites. When finished, click Sign. The ED visit note is not included in this education and will soon be retired. The next tab is the ED Provider Documentation. This note is designed to improve communication with primary care physicians related to a patient's ED visit. After selecting ED Provider Documentation from the menu, the Provider Documentation list will open. Select Add to start a new note. Selecting a note type and note template are required before starting the note. For type, select Emergency Department Note Provider, and for template, select ED Course Workup. The note type selected will determine which folder the note is filed in the document section of the chart. Selecting the ED Course Workup template provides you with a note that will pre-populate relevant information and provide a free text field to dictate a narrative of the patient's ED visit using Dragon or Auto Text. Select OK to begin documenting. The ED Course Workup consists of the following sections: ED Course, where the provider will complete a narrative of the patient's visit using Dragon or Auto Text. Provisional Discharge Diagnosis shows the discharge diagnosis entered in the Depart process. Clinical Workup shows recent vitals and measurements and labs. This section of the note is auto-populated. Diagnostics Results shows the name, date, and type of any test done during the ED visit and is auto-populated. Prescriptions shows the discharge medications prescribed for the patient. Patient Education shows the education selected during the Depart process. And the follow-up section notates all the follow-up information entered, along with a generic note to the patient regarding follow-up with a specialist. When the note is complete, select the Sign Submit button. If the note is not complete and you need to leave the patient's chart, select Save or Save and Close to return at a later time. Once the note template is saved, it is published and viewable in the patient's chart. After clicking the Sign Submit button, a smaller window appears to review your note's information for accuracy. An attending physician will have a Sign button to complete this step. After signing the note, you will be directed to the provider documentation list where the note will show as a final report. Residents and MLPs are required to forward their ED course workup note to their attending physician for co-signature. After clicking the Sign Submit button, a smaller window will appear to review the note for accuracy. After clicking Submit, you will be directed to the provider documentation list where the note will show as a preliminary report. To forward the note to your attending physician, click the Forward button at the top of the window in the toolbar. From the drop-down menu, select Sign. In the To field, type the name of the physician you are forwarding the note to. If the name does not automatically fill in, click on the binoculars to search for that provider. Pay special attention to the name of the physician you are forwarding to, as many physicians have very similar names. Thank you for viewing the ED Provider Documentation Training video.